Welcome dear doctors to Kids Discovery. Myself Dr. Parv and we are discussing the subject of pediatrics. Let's start our discussion of pediatric orthopedic and rheumatology topic that is called as transient synovitis. Now, synovitis is itself self-explanatory, which says that there is inflammation of synovial membrane which has happened. That's why the name is transient synovitis, which is also called as toxic synovitis. Okay, so the name of the topic is transient synovitis, which is also called as toxic synovitis. So what is the definition? Please understand, name is telling you it's an inflammatory disorder. Okay, so it's a self-limiting. Okay, so it's a self-limiting inflammatory disorder. So from S it is synovitis and from S it is self-limiting. So it's a self-limiting inflammatory because it is synovitis, is inflammatory disorder. It is the most common cause of acute hip pain in young children. Most common cause of acute hip pain in young children. Okay, so it's most common cause of acute hip pain in young children. Okay, clear, easy. Synovitis is the most common cause of acute hip pain in young children. Okay, so what is the age group? Age group is 6 years. So S for synovitis, S for 6 years, you can remember. Okay, and yes, so synovitis it is more commonly seen in boys. Okay, so it is more commonly seen in whom? It is seen in boys. Okay, just remember this. So it's more commonly seen in boys. So remember, what is the etiology, what is the pathogenesis? So the etiology of synovitis is that there is aberrant immune response to the viral or bacterial antigens. Often it is going to follow the upper respiratory tract infection. So what happens? Let me just teach you. So there are, for example, this bacteria has entered my respiratory tract and it has caused an upper respiratory tract infection. So 1 to 2 weeks later, what I am going to have is that after 1 to 2 weeks, I will see that this bacteria, this virus has damaged, has hijacked my immune system. And even if this bacteria is dead, okay, bacteria is dead, but the antibodies which were formed against these bacteria, okay, some antibodies were formed against these bacteria, these antibodies are going to fight. Okay, these antibodies are going to fight with these respiratory infections. These antibodies are going to fight with these respiratory infection. Please remember, this is nothing but a very benign disease. Okay, this is nothing but a very benign disease. I have told you this is a self-limiting disease. Okay, so what happens in this? So remember that child, because it's a benign disease, now child appears non-toxic, but the problem is that because synovitis is there, light pain is going to be there, the child will not be able to bear weight. Of course, there will be fever because it's inflammation, so there is minimal fever which is going to be there. There will be leukocytosis, again it's going to be mild leukocytosis, like WBCs are going to increase approximately 12,000. ESR, CRP are also increased, but approximately the lower side. The key differential features. Now, see, there is something which is called as septic arthritis. What I am trying to tell you is transient synovitis, but there is a key differentiating feature that is called as the fever and the weight gain. See, what happens is there is a condition which is called as septic arthritis. I am writing it here. In septic arthritis, there is sepsis. Particularly this sepsis, that means there's a lot of fever which is going to be there because in response to the sepsis. Of course, in both of these conditions, the child is going to refuse the weight bearing. But in transient synovitis, child takes the weight, but of course limping is going to be there. But believe me, in septic arthritis, the child refuses even to bear a single kg of the weight. So this severity is helping us to differentiate between the septic hip and the transient synovitis. So what will be the imaging findings? Because the synovitis has happened, so there will be intracapsular, because synovial fluid, synovial membrane is inside, so there is intracapsular hip effusion that will be there, whereas in septic arthritis there is a unilateral effusion which is going to be there. Of course in transient synovitis is going to be bilateral. Okay, it's going to be bilateral, but in septic it's unilateral, but a lot of effusion is there. So synovial fluid, of course it's going to be a sterile fluid because no infection is there. No organism will be seen in gram stain. WBCs will be elevated but not very significantly, okay, because it's a milder disease. Yeah, of course in septic hip there's going to be a very high amount of WBC. So what is going to happen? See, the thing which we have seen in the tenosynovitis is that, you know, the knee is involved, and because the knee and the thigh, anterior part of the thigh, both of them are supplied by obturator nerve, okay, obturator nerve. That's why this pain in the knee is referred in the anterior thigh also. So have you heard of this word that is tick tock, very famous, tick tock? So just remember tick tock tack, okay, tick tock tack. Now what is tick tock tack? Tick tock tack means A for anterior part of the thigh, which will be involved, and K for, of course, knee. Why it is involved? Because of O for what? Obturator nerve. Because of the obturator nerve, anterior part of the thigh and knee, both of them will be involved. So you just have to manage them conservatively, give NSAIDs, okay. No antibiotics, no surgeries required. It's a very mild disease, okay. It's very milder disease. Please ignore this picture. I think accidentally they have kept this picture over here. But this was my short little topic of transient synovitis. See, I have kept this topic to tell you that as an MBBS graduate, you must be able to differentiate between the patients whom the treatment should be started and to whom the patient should not receive the treatment. So, you know, in transient synovitis, it's a self-limiting disease. So just do the conservative management. Don't start with some big drugs and invite the unnecessary side effects of those drugs. Okay. So I am thankful to you that you heard to our lecture and paid full attention. Thank you so much. We'll meet you in the next class. Thanks.